Good afternoon, everyone. I was told to stand close to the microphone. If you can't hear me, raise your hand or let Jacqueline or someone know. As Dave said, I'm Diane Breslow. I'm part of CurePSP. I'm a retired social worker who has lived and worked in the Chicago area my whole career. I want to thank CurePSP and Jacqueline and Trish and Dave and everyone at the foundation for inviting me here. It is truly an honor to be a part of this experience and a small part of your lives for a few hours. We had a wonderful caregiver support group yesterday, and I have to say that everything that came out in that support group, from 20 or 15 people's experience, was completely confirmed by the scientists and the physicians who are here today in terms of the variations of the disease, the needs of patients and caregivers, the journey that people are on, and most importantly, and what I've just spoken to people about most of today, is the need for connection and community that comes from a conference like this and maintaining these connections even after you leave here today. And I think that is really important. So if you haven't yet shared with each other names and email addresses and made that kind of connection and that kind of lifeline, I really encourage you to do so. And as Dave said, I'm on the Caregiver and Patient Advocacy Committee, and several people actually came up to me and let me know they were interested in talking with and listening and helping other people who are new to the journey, people whose loved ones have already passed on, who want to help other people. So we've gathered the names of peer volunteers. There's going to be more and more people through the foundation for you to talk with. So continue to reach out. That is going to be probably the most important message of my talk. So, as Dr. Simuni said this morning, who doesn't want to feel in control? You get a diagnosis, you feel helpless, you feel out of control, and it feels like this is the worst day of my life. It's the worst day of the disease in many cases because you don't know where to go and you feel powerless. The best day, and maybe it's today for some of you, the best day is the day when you can say, my family and I have found some ways to deal with this, and we know we're not alone, and we have a roadmap and we have options. So it's important to know that there are things that we can do along the way that can help us, and that's really what I'm here to talk about. So, a quote that I like that kind of speaks to that is, we cannot direct the wind, but we can adjust our sails. So we're here to do that, and what I'm going to talk about today is why and how to have a core care team, how to integrate that team over time, all the different members that are part of your care team, and how to expand that network over time so that more and more people are in your support system, and that's what it's all about. So first, why and how to build your care team. We already know the disease is so complex, one of the most complex diseases. We know that one discipline, a medical person, a physical therapist, whoever it might be, cannot address all of the needs. We know that every single case is different. We know that the disease is going to continue. So the point is, if there are so many needs and so many areas of life affected, we need people in our life who can help us address all of those areas. So what we're looking at is how to build a holistic team. We know that going to the doctor is our first is our first line. It's the person who gives us the diagnosis and the person who's willing to talk about options out there, clinical trials, medications, et cetera, et cetera. But we also know that there are many other, not only disciplines, but interventions and kinds of support programs that can play a big part in our care. So first of all, what do you want from your care team? You want a care team, meaning a doctor and some of the ancillary or complementary services like the therapies. You want a team of people that respect you as the patient and your partner as part of the journey, as being central to the team. You don't want people that want to make decisions without engaging you in the decision-making process. So you don't want somebody so authoritarian or authoritative that he or she knows the answer for you. It should be a dialogue, and you should trust and feel comfortable with your neurologist and part of the ongoing decision and decision-making throughout the whole process. What you're looking for, and I hope this is succinct because it says everything I believe in, you are looking for a team that will deliver over time the right blend of clinical care, information and education, emotional support, and programs, all with the end goal of maintaining or improving quality of life throughout, from the day of diagnosis throughout. And you want that care, hopefully, to be provided in a coordinated, seamless manner where professionals know one another, communicate with one another, and are on the same page with you, with your care partner, and with your core team. So that would be a slide to like review and remember when you're thinking over how is your care progressing. How to integrate the care over time. So this is a slide that's a little bit similar to Dr. Simuni's, and this shows your care team, and you are in the center of it. You can see that. You're in the center of your care team, and your care team will always include a neurologist. That neurologist should be a specialist in movement disorders, not a general neurologist, but somebody who is fellowship trained and has a specialty and sees more of these cases over more time than a general doctor or general neurologist. So you want a movement disorders neurologist. Maybe you will have a physiatrist who's a doctor of rehabilitation medicine through a rehab institute, and a team with intermittent, not necessarily continuous, but referral for physical therapy, speech therapy, and occupational therapy. And over time, and we'll talk more about this, you want your team to include other family members, friends, volunteers, people from your church or your synagogue, and each other. So think of your team as, spreading out like this from the initial core team all the way out to the community. So I think we've gone over probably every speaker who is on your multidisciplinary team. Does anybody have any questions right now about that, or how to get these referrals, or who some of these professionals are, if you haven't yet had exposure or contact with any of these health professionals? You can ask questions at any time. Any questions about that? No? Okay. Okay, sure.
You mentioned that you collected email addresses of volunteers who are able to help with information.
Yes.
Is there a way to get that, or how do we reach out to them?
You know, I've been taking email addresses from people if you want to write it on a piece of paper. We're having actually a patient caregiver advocacy committee meeting on Tuesday, and I thought I would let the committee know at that time that we have a whole new interested cohort of volunteers. So if you want to just write your name and email address. And then what we're doing is we're calling all the peer volunteers that have been on our list for a number of years, as well as new people, and saying, are you still interested in being a volunteer? If so, what kind of role do you see for yourself? Do you see yourself as somebody who can have one-to-one contact with a patient, with a caregiver? Do you see yourself as somebody helping out at these kinds of conferences, doing fundraising, doing advocacy? What are some of your strengths and how can you help as a peer volunteer? So that's what we're looking for, and we're just looking to, you know, kind of tighten up and expand both, really, the program. So yeah, thank you. Thanks.
I was wondering,
please.
how is it that you find a social worker?
Okay, that's a good question. I was going to talk about the role of the social worker and the role that I played in a dedicated movement disorders clinic for 11 years under the direction of Dr. Simuni. If you are fortunate enough to be in a big city like Chicago with a university and an academic medical center, there are movement disorder staffs and often social workers dedicated to those teams. If there isn't a movement disorders social worker where you live, then there's a few options. I mean, I know we've talked a lot about Parkinson's disease here, and I don't in any way mean to discount or marginalize PSP, because I realize, you know, everybody's importance and the disease itself. But that said, the National Parkinson Foundation on their website does have a list of social workers, some affiliated with Movement Disorder Center and some not. So that is one place. They address, but not like this foundation does, they address other movement disorders than Parkinson's disease. There's a group called Care Managers. You could find them by Googling them. And if you go through those, it might tell you that there are some with specialties in movement disorders. I have to say, it's not a real popular specialty. I mean, it's something that you kind of grow into, or like with me, it's just the way my career path evolved in social work until it became an expertise and a specialty. And there aren't a lot, but that said, if you have a social worker that you know and trust and that you know is a good resource and a good advocate and a good ear, you can help that person to learn about the disease. And that's part of what I think our role is, mine as a social worker, but all of ours as knowing this disease is to educate people who don't, and a lot of them don't. So if you have other ways of finding a social worker in your community and somebody who's interested in learning, that's another way to have a social work connection. Anybody else want to jump in here? Because this is a small group. We can hear other people's comments.
I have a question. On the neuro ophthalmologist, could you talk a little bit more about that, and also sort of where do you find that? Is that a referral from other doctors, and what role does that partner play?
Mm-hmm. Yeah, well, I met somebody yesterday who said it was neuro op that actually first pinpointed the diagnosis for them. So yes, it's a small specialty also, but there are neuro-ophthalmologists, and you would ask or look for a referral to that particular specialty. So it's an ophthalmologist who really has two fellowship trainings, two specialties, neurology, ophthalmology, and bridges between the two, and works with a lot of our PSP patients helping with different adaptations for the eye, exercises for the eye, prisms for the glasses, all kinds of things like that. So usually the movement disorders neurologist will make that referral or that recommendation, and a lot of people benefit by it. Anybody else? And anything you have to add, we haven't met, but anything you have to add, please. Okay. Yes?
Had issues with certain professionals because of lack of education. Had issues with nutritionists at rehab centers whose idea of feeding my husband, who was also diabetic, was just giving him what everybody else had and upping the meds to compensate for it, which is not a healthy thing to do. Had issues with a speech therapist whose attitude was, well, he's going to lose his voice anyway, so why do I have to work with him?
Not the right person.
And also had issues with a social worker who didn't understand the disease. And no offense,
Oh,
but
I don't think
actually
that-
made me mistrust social workers.
Yeah, that,
Because
unfortunately,
instead of
that
helping
happens.
me, she was hurting us.
Yeah, I'm always sorry to hear that. I'm always sorry to hear that, because I know that if somebody has had a negative experience, they are reluctant, and I can understand
Okay,
that.
so
And-
that brings up the question, all three of those together, how do we educate these professionals
It's a
when,
really good
about
It's a very good.
patients with neurodegenerative diseases and the caregivers who take care of them?
It is one of our missions at CurePSP and in movement disorder centers in general to educate other neurologists, other even movement disorders neurologists that may be in like a solo practice without a team, rehab centers. I've done so much training of home health agencies, therapists, and just reaching out and offering this education, which CurePSP does and hopefully will do more of.
Hopefully it'll spread across the country and not just be in the eastern
Yes?
seaboard,
Yep.
is what I'm hoping.
Yes,
And
we
I
do
definitely want to be
too.
a part of that.
Okay, thank you, thank you. Okay, okay, one more and then, yes, good, Trish, thank you.
To your question, I want to say that, can you hear me on this? No?
There you go.
I have one here for you. Sorry, real quickly, it is a very daunting task to do just as you say. We know we need to educate healthcare professionals across the country, and not just neurologists, but all the professionals that work with folks that might have one of these diseases. And unfortunately, advocacy, self-advocacy is going to be part of this. And we do have an educational piece that's designed for social workers, physical therapists, occupational therapists, and speech and language therapists. And this document has been written by those in the profession who have experience. So it's a good starting, it's a good discussion. However, we are also very willing to provide in-service training or some online training if there is a group or if there is an individual. Perhaps it would be a conversation with us or a training. And we do that case by case because we can't meet every healthcare professional in the States, of course. So I offer that to you. My name is Trish Caruana. If you do have any kind of need such as that, please contact me and we'll arrange something.
Thanks, Trish. Okay, I'm going to proceed here and then we'll stop again for some more questions. The first question was about social work, and I do want to say that if you find a social worker that you trust or you've gotten a good referral, about, a social worker can really play a significant role in helping you to integrate over time the various disciplines and agencies, because you may be involved with agencies that don't know of one another's existence or haven't worked with your particular physician before or whatever. And the social worker can really be that link, that facilitator, mediator, communicator, and bring everyone together and bring everyone on the same page. A social worker has more roles than that, and I hope that if you need a social worker, you find someone that is helpful in addressing concrete resources and concrete needs, of which there are many, all the way through the spectrum to the emotional needs and all the changes and what's it all about, what's the meaning of this, what am I learning from what happened to us in life, and how can I make the best of this? Because in the end, that's what it's about. It's about we never expected this, we never thought about it, knew about it, signed up for it. It happened, and we're here to do the best we can. And that's everyone here. As I've said before, what about all the people who aren't? And you know, I think about them, the people that don't realize that there's help out there, that don't know the foundation exists, that don't know another soul. It's really tough. So, you know, this is a very sophisticated, very educated audience, and you should all really commend yourselves. And also, I'm just awed and moved by the dedication of the families. There are families of 5 and 6 people here. I mean, it's just a beautiful thing to be a part of, and I really commend all of you for it. I know it's not easy. I've worked with some of you, and I've worked with many people like you, and I've been privileged to be there from the beginning, and I really commend all of you. So, okay, social worker's role. How would you become a partner in your own care and in your care team? You're doing that by being here. Learn who's on your team, what their roles are, how to access their services, just like you asked, how do I find a social worker? How do I find a physical therapist? I know I need a home safety evaluation. Who will do that for me? And how will I get it? All of these questions, educate yourself, know the questions, and when you have the answers, write it down. You never know if you'll need it today or you'll need it in 6 months or a year. So get to know who the players are or who the players may be down the road, and just keep your log, your journal going, and you'll have the information at your fingertips when you need it. Encourage someone or many ones in your family and in your close, trusted circle to learn about the disease and to come with you to appointments. We have someone here that just also touches my heart. This is a lifelong friend that's a part of someone's care every step of the way, the caregiving and the patient's life, in the office and at the home and on the phone, and a part of the care team. So if you have someone like that, wow, you're really, really fortunate. And make sure that you feel comfortable and have communication and know how to reach everyone on your team. Okay, I don't know if we talked about this today, if Dr. Simuni really specifically zeroed in on this. This is a slide that explains what to do and how to prepare and what to look for when you go see your neurologist. Some of you are in the very beginning of this, some of you are further along, and this will be quite redundant, so I'm sorry for that. But bring with you all the time a list of current medications, including the dosages, the times you take them, and any of your comments about how they're working, whether they're working, when they're working, all of that. Inform your neurologist of any changes that have happened. You don't see your neurologist all that often, so in 3 months you could have had another incident happen to you. You could have had a hospitalization that your neurologist doesn't know about, so bring him or her up to date on your current medical history. Ask questions, write them down and bring them with you, and hopefully you have a doctor that's going to sit with you and listen to your questions and answer your questions. And if there's something you don't understand, of course, ask, because there is a translation of all the medical terms that we hear. There's a translation in our language that really does make sense to us if you ask for it. And if your neurologist hasn't yet brought up the idea of referrals for some of the therapies like PTOT speech, social work, even a palliative care evaluation, a brain donation. If you have a question about these things, don't be afraid to ask them. Sometimes physicians will wait. I mean, there's such a thing as timing, and you don't want to inundate a patient right away with every possible question that you're going to want to address over the course of their treatment. So a physician may wait to bring up certain things, but if it's on your mind, like came up in our group yesterday, ask the question. You know, the doctor won't know otherwise that you're ready to address a certain issue unless you ask it. You might want to talk about feeding or feeding tubes or types of food. Even though you're not there yet, you still might want information because you heard something and you want to know if it's right or wrong or something like that. So don't be afraid to ask questions. Okay. Have the person who comes with you take notes. That's really important. No matter who we are going to the doctor, there's just a lot of information out there, and sometimes it's overwhelming, and you're already anxious, and you're already stressed, and everything else, and you've driven 100 miles to get to the doctor. So make sure that you take notes, and you can look at them when you go back. Make sure your neurologist knows who your primary care physician is, because questions may come up about medications that one doctor has prescribed that the other one wonders, do these go together or not? Are there contraindications for two different medications or not? And they may want to discuss it and make a collaborative clinical decision on your behalf. And before you leave the appointment, you're going to have, maybe a new medicine, maybe a new referral, maybe a new schedule, a new suggestion. Make sure that you understand what your next steps are going to be and what you're going to work on until you see the doctor the next time. Okay, expanding your care network. So this is where we get into what I'm talking about in terms of family members and friends. And we talked yesterday about classes, and we talked about adult day programs. These all become part of your whole armamentarium of resources that hold you up and make your life richer and better, both as a caregiver and as the patient. One example, an adult day program. I don't like to say daycare. An adult day program where someone with PSP can go for the day from 9 to 3, be picked up, have a meal, have music therapy, have art therapy, meet other people, even if not with exactly the same diagnosis, other people who have a reason to be out and in a program and socializing, and spend some quality time with other people at the same time the caregiver has their own time to take care of their needs, their household needs, their own person, just de-stress and relax. So Adult Day is a marvelous, marvelous invention. It's been around for a long time, and we've made lots and lots of referrals for Adult Day programs with a lot of success. So that becomes a certain piece of your treatment plan at a certain time, very possibly. People go to rock steady boxing classes, they go to exercise classes, even if they're in the community, in a community center, they may not be a neurological specific exercise class, but if somebody can go with your loved one and assist, it could still work, it could still be appropriate. A lot of it is an individual decision. Some people might not feel comfortable. Some people with a neurological condition might not want to go to a generic kind of exercise class, but some do. So just think of your options and try to expand what you think of as your options. Years ago, I worked with a caregiver named Chris, and actually he and I spoke together many years ago at a PSP conference, and he was just a loving caregiver with lots and lots of creative ideas, and also very able to describe his caregiving journey, which, by the way, I gave you a book list, and we're selling a book back there similar. So his wife was a gardener and loved flowers, and he set up a thing where every Friday one of her different friends of hers came over and brought a bouquet of flowers from their garden and had a visit with her. And every week Anne had a flower arrangement on her table until next Friday when someone else brought a new one. I mean, it was just a beautiful thing. And a visitor every week, and something to keep until next week. So he also said, and Kathy here, who I met, said for herself, and she was a caregiver, she had a restaurant she would go to, and they would know her, and every week she would walk in and sit down and just be able to have a sigh of relief and go, I'm welcome here, I'm known here, this is where I can come every Friday at 10 o'clock for my hour to myself. Well, Chris, the caregiver, he did this with Anne, and they lived in Evanston, which is a small, really neighborly, close-knit community, and they went into the same restaurant week after week at the same time until they felt like they were family, and they knew that they were welcomed, and she wore a helmet, and they were comfortable. And they felt at home, and this became part of their routine. So people have really touching and creative ideas, and it is what works for you, and it is kind of trial and error, and I don't really mean error because I don't think there are errors, but it's trying different things, getting ideas, and instead of saying, oh, that'll never work, trying it out. And when you think of your care team, think that all these people are there. I met a lot of people who have visits from clergy or church volunteers. That's wonderful too. People have said and recommended, and I agree, if one person doesn't want to be a visitor to someone with PSP alone because they're a little nervous or they're a little threatened or they're a little uncomfortable, tell them bring someone with you. Make it more of a three-way conversation, or make it a two-way conversation where the person with PSP, even if they can't make an enormous contribution, they can listen and chime in when they want to. So bring two people instead of just one at a time to visit. All sorts of great ideas, and at some point we can write all these down in practical pointers and, help to realize that you're not alone. Legal services, I'm so glad we talked about here in terms of advanced directives and in terms of disability. Support groups, and if you don't have a group, we can help you to start one, and like I said, also connect you with peer volunteers to talk with over the phone, on Facebook, and other social media ways. Okay, then I have a few resources, and we don't have to go through them. These caregiver resources, they're not specific to PSP, but they are caregiver resources for all sorts of things. Stress reduction, advanced directives, talking with other caregivers, caregiver rights, finding resources and help. So caregiver associations are very helpful. Coming up in Chicago, if anyone lives here, the national, which one is it? Caregiving.org is having their national conference here in November. And I'm really pleased to say that they're a general caregiver organization, and they have kind of a dementia track as well. And this year I submitted a proposal to discuss specifically movement disorders caregiving. And I'm going to bring a panel of 5 caregivers that each have kind of their own area to talk about. Like one of them is a long distance caregiver, one of them is somebody who wanted to explain the disease to children, one of them is somebody that went through the whole hospice journey and can talk very eloquently about that. So I'm going to have 5 caregivers with kind of 5 different areas and address questions to them as a panel, but specifically related to movement disorders, not general caregiving. And I think, talk about education and increasing awareness, I think something like this is part of it, that when people are giving conferences and addressing issues of older adults or issues of degenerative disease or whatever, that this particular disease gets noticed. And so that's why we're doing this. So that'll be November 10th and 11th, right at one of these O'Hare hotels. Did people here go to the support group leader training? Did any of you? It took place yesterday. And anybody here in a support group, or not too many? Have any of you looked to be or want to be, or they just don't exist? All of the above, I guess. When support groups work, when they click, they are a magical experience. And if you can start one or find one of similar people in going through this similar experience, well, like we did yesterday, it's just an awesome experience to share and to care and to feel that everyone in this circle with me today understands. And that feeling in itself is worth millions. So if you can find a support group, it's helpful on every level. It's helpful from the most practical ideas. I brought something that worked for my husband. I want to share it with the group, to, I need people to hear what kind of a week I had this week and, hold me. And everything in between. And speakers, I spoke to Dave earlier. He mentioned that he brings a lot of speakers into his support group, and what's so wonderful about that, and I have done this too over all the years that I've led support groups, if you bring a speaker in, you're sort of inadvertently or not bringing in maybe a new member or two, because there's people out there that haven't come to the support group. They shy away from it. They don't know what to expect, and they're nervous, but you're having a speaker about, let's say, Tai Chi, or disability law, or something like that, and that topic interests them, then they'll show up at the support group. And maybe they'll like it, and maybe they'll come back. So it's really good to have speakers. It's really good to let people know in advance that you're having a speaker. And it's also good to get from your group, if you have one, what are we interested in doing this year? How many months do we want speakers? How many months do we want a free floating discussion? How many months do we want just a social conversational time? And get the group involved in planning its agenda for the year, or even for 6 months at a time works. So yeah, I'm a big supporter of support groups. On the other hand, I do know, and I don't know if I have it in here, but there are people who don't want one or who can't get to one, and we I respect that and I understand that, and I hope that you will find other ways to get support, because one-to-one is as valuable as a group if you connect with someone and you have a phone call, once a month or once a week, or a meeting, face-to-face if you're in the same city. So peer-to-peer support is also invaluable. Exercise resources, if you're looking for beyond the therapy, let's say that you've had some physical therapy, it's over now, you really can't be continued or covered, let's say, for another 3 months or 6 months, or until some change occurs in your situation, but you want to maintain the gains that you've gotten through the therapy, you want an exercise class. How are you going to find an exercise class? Park districts, community centers, rehab centers, hospitals. There's lots of videos, lots of DVDs out there with exercise. People have already mentioned Lee Silverman, big exercises. So this is something that you should be able to find either on your own or with the help of your physician, your social worker, other people in the PSP community. So don't be afraid to get your own exercise resources, legal services, advance directives. If you need any assistance in finding an advance directive and you don't have it from your own medical institution, your state medical society has forms, Aging with Dignity has forms, and caregiver.org. So there's plenty of places to get them. You don't really need a lawyer to fill out a health care power of attorney. They will do it, and then they will do it expertly, but you don't need that. You can do that on your own if you haven't yet. Okay, this is a good one. This is called the Vial of Life. And again, I think this applies to everyone, and I really can't say that I have done this, and I mean to do it too. It's have a list in your home. Okay, I'm winding down. Have a list in your home with all of this information about your loved one with PSP, but even about yourself, so that if anybody has to come into your home or needs this information, a relative or friend or even 911 if that's the case, all this information is in one place on one piece of paper. We call it a vial of life because you can write it, you can roll it up, you can put it in a little jar, and it can be on your counter or in your refrigerator. It can be somewhere where you know it is, and you or someone at home can tell other people where it is. So that's called a vial. Oh, we are done. Okay. So thank you again. I never mind being contacted. You can email me. When I say retired, really, I'm retired. I'm just doing all of this because I want to and I can. So you have my email address. And thank you very, very much.